Good morning, everyone. Thank y'all for joining us. Dr. Navarre is having just a few technical difficulties on her end with her computer, so if y'all will just bear with us, we may be starting just a couple minutes late.
All right, thanks everybody for joining us. We're going to talk about herd health today and why we kind of need to think about preventive health programs and get away from thinking about things in a disease, treatment, vaccine standpoint. So, advance.
We are having every kind of problem. I'm advancing it on my side, but it's not advancing down here.
There
it goes.
There it goes. Okay, so cattle health problems are really about management and less about, again, vaccines and how we treat things. And health management is really about stress management, and nutrition is a really, really big part of that. Other stressors like cattle handling, weaning are all important. We have to handle cattle, we have to wean cattle, but we need to make sure we do those as low stress as possible. Some of the really major diseases that we deal with, and we'll talk about a few of these, they're really not treatable. They're viruses or they're bacteria that we don't have any treatment for. And so the only way, and sometimes we don't even have really good vaccines for them. And so the only way to prevent those is a preventive program. And even those diseases that we may have treatments for, like bovine respiratory disease complex, when you have a prey species like cattle, they do everything they can to try to prevent those diseases or prevent people from seeing that they're sick. And so by the time we figure out that they're sick and we go to treat them, we're really late in the disease. And so our treatment success is very low. Next slide.
There's going to be a little bit of a lag, I think. There it goes.
Okay. So if you look at the left side of this slide, we have, once we have a disease, we have to figure out exactly what it is so that we can try to treat it. And again, a lot of the diseases that we deal with, there is no therapy. And where we really want to be is on the right side of this diagram, in the stewardship side of things, where we can manage stress. We can have a biosecurity program. We can manage the environment as best we can. We can manage nutrition, other diseases, all the things that influence the immune system. And that helps us prevent diseases and helps prevent us having to go back onto that left side where we actually need therapy, because once we have to treat an animal, we are really losing a lot of production. Next slide. So this ties into beef quality assurance very well also, because BQA is really also about stress management, and stress impacts health, and the health impacts the need for treatment, and that need for treatment then increases the risk of a residue or a defect in the meat, and so that impacts the safety of our product. And then stress also impacts the quality and the profitability of those cattle. So it impacts growth, it impacts reproduction, and quality grade. Next slide. So let's talk about a couple of diseases that are examples of why we need preventive health programs. So bovine viral diarrhea virus causes a lot of different syndromes. And we do have a vaccine, and most of you are probably using it, but it's not 100%. And so it's about 80% effective when it's given to healthy, non-stressed cattle. So you might say, well, why should we vaccinate? Well, it prevents you from having, a complete wreck. So if this disease gets into a totally naive, unvaccinated herd, you can have abortion storms, diarrhea outbreaks, deaths, severe respiratory disease, because it's really an immunosuppressive virus. And so vaccinations is going to keep you from having that. What happens when BVD gets into a herd that's vaccinated is it's really a reproductive disease, and it causes early embryonic death. And so it's very sneaky. It's not causing a lot of sick animals, so you may not even notice it if you're not keeping good records. And so we do want to vaccinate, but we also have to have a good biosecurity program to try to keep this disease out. Next slide. So trichomoniasis is a venereal disease that causes really no symptoms in bulls. Bulls are the main carriers, but cows can also be carriers of this disease. It causes early embryonic death also. And so it's financially devastating when it gets into a herd. there's no treatment, and there is a vaccine, but the vaccine is really more about helping a herd clean up the disease faster once you have it versus actually preventing this disease. So the state will allow you to purchase a bull with a negative test, but the testing, unfortunately, is not 100%. So depending on your business model, if you really want to keep this disease out, then we're going to buy virgin bulls. We're not going to buy cull cows. We're going to buy virgin heifers or late bred cows or heifers, not borrowing bulls, loan out your bulls. So really, we're talking about a biosecurity factor or program here to prevent this disease. Next slide. So herd health programs, as you've probably guessed already, is really not about a vaccine program. It's much more. Vaccines are a part of that, but it's not going to be sufficient alone. And so we need to talk about good management and attack these things at multiple points. So anything that affects the immune system, any of those stressors. And the Sandhills calving system is a great example of why management can be so important. So the Sandhills calving system was developed in Nebraska when there was a veterinarian was working with a lot of really large herds that were having horrible calf diarrhea outbreaks, and sometimes 50% of their calves were having calf diarrhea, and the bugs that cause calf diarrhea are viruses for the most part, and so there's not really a good treatment for them other than fluids. But once a calf gets diarrhea, it's kind of a black mark on its production the rest of its life. So we want to prevent this. And so what they instituted, you have to understand that when you have you're calving all in one area, the bugs that are out there, the calves are little incubators of those bugs, and the more calves you have, the more of those bugs you have in the environment. And so as calving season goes on, you get this buildup. And so the Sandhills calving system was developed to break that buildup cycle. And so what you do is you start calving in one pasture, you calve for 1 to 2 weeks, and then the pairs stay where they are, and you move the pregnant cows, you calve over another 1 to 2 weeks, move the pregnant animals. And so you are age segregating these calves, and every new batch of calves is being born onto clean pasture. And just that management change, no vaccines, no nothing, had a major impact on breaking those calf diarrhea cycles. So even if you don't have a large herd and you don't have multiple pastures, if you know how many of your cows are supposed to calve, when half of them are supposed to calve, then you can move the pregnant cows. Even if you divide it up into 2 calving pastures, that can really be helpful. Next slide. So these are the 6 parts of a herd health program. We're not going to talk about all of these. We're going to mention nutrition a bunch. Parasite control is really important. It does impact the immune system. We have a beef brunch already on parasite control, so I would point you in that direction. We also have fact sheets. We're going to talk about biosecurity, genetics, and then minimizing stress. Next slide. So prevention is always cheaper than treatment. As I mentioned, once an animal gets sick, particularly if it's a growing animal, it's never going to really live up to its genetic potential. So we really want to make sure that we do the best we can to prevent these diseases. Next slide. So the tip of the iceberg, for every sick animals, a lot of the diseases that are really costly to our herds, for every sick animal, we have multiple animals that are not telling us they're sick. And the only way to find those might be to test, but they're still costing us money. Parasites are a really good example of that. We don't see a lot of clinical disease from parasites unless you combine it with nutrition problems, but they are costing us money kind of under the table. Next slide. Dr. Edwards, I can re-record this if you would like to make it a little bit better for posting. So common mistakes for common conditions, reaching for antibiotics when antibiotics really won't work. So the really good example of that is a lame cow or bull. So antibiotics are really only indicated for early foot rot. And, we have a fact sheet on foot rot and other lameness, causes of lameness. So I would point you in that direction on our website. But there are a lot of other causes of lameness that are really antibiotics are not going to help you, and you have to have a good diagnosis. You can have sole ulcers, you can have joint infections, you can have bone infections, you can have fractures in the foot, and those are treatable if we catch them early. But just continuing to say, well, that it must be foot rot and that antibiotic didn't work, let's give them another antibiotic. Early foot rot responds very well to almost any antibiotic. So if you treat one and they don't respond, you need to get an accurate diagnosis, because we also want to make sure that if we need to sell this animal, these antibiotics can get out of their system. We don't wait and linger on so that they lose more weight, and we can manage them properly. Next slide. So anaplasmosis is another really good example of a disease that is really kind of the tip of the iceberg. We have, on average about 1 death per year in an average size herd. But what happens is you also get abortions from anaplasmosis. You also have decreased weaning weights because those cows that have anaplasmosis but don't die, their milk production really drops. And so when we're looking at the cost of a vaccine or the cost of chlortetracycline, the cost of testing to try to see where we are, it's expensive, but we have a very expensive disease. So these are the kind of things that we have to kind of weigh back and forth to say whether or not, how are we going to prevent this disease, and what's the most cost-effective way to do that. Next slide. So there are over 100 diseases that can cause sudden death in cattle, and not all what appears to be sudden death is really sudden. Sometimes we have a chronic problem, and then we have, say, a cold snap that pushes these animals over. But there's just so many causes, and those of us who've been at this for a long time, we're pretty good at narrowing that down based on where these cattle are, what time of year it is, a little bit about the management. But at the end of the day, it's still a guess. And so the only way a lot of times we can make a diagnosis is a necropsy. And you don't want to let any animal that dies, you want, to really honor that animal's life. We want to get as much information as we can out of that animal to then prevent further deaths if we can. And so a necropsy is just essential anytime an animal dies. Now, you may not be able to get somebody to do it. It's very difficult to get some of these animals into the diagnostic lab, but your veterinarian, if you work with them, can at least give you some basic techniques to do these necropsy by yourself. And you can look for liver flukes. You can look for the color of the skin. It's pretty easy to diagnose anaplas or rule anaplasmosis out with basically just opening these animals up. And so it's something that you may not be able to get a full necropsy, but we want to get as much information out of these animals as possible. Next slide. So a herd health calendar, everybody really needs one, but there's no generic that works for everyone. And there are some out there that are a really good place to start. And there's going to be a lot of overlap. So, if you're a spring calving herd, you're going to do a lot of the same things. We all treat for flukes at the same time. We're all going to need to deal with flies at the same time. But when it comes to vaccinations, when it comes to deworming, those things really need to be tailored to your operation, exactly what you're doing and when that is. And sometimes, the timing of it is really important. And so herd health programs are kind of like an insurance. We all need one, but not everybody needs a farm and ranch policy. Sometimes you just need a homeowner's policy. So it's really dependent. Next slide. So, and it's really about efficiency also. So the timing of things. So the best time to deworm might not be the best time to vaccinate. And so your veterinarian can really help you look at your goals and your management and what your potential problems are and say, well, the timing of the deworming is more important than timing of the vaccinations, or vice versa. So we're not having to work cattle more times than necessary. Working those cattle risk injury. It costs us money, and so we need to, again, when we do work them, make sure we're doing low stress, make sure we're culling cattle on disposition, poor disposition, but trying to time things so that we lump as many things together as possible is really more efficient. Next slide. So as I mentioned, nutrition plays probably the biggest role in herd health of any other factor. And, traditionally, we really pay close attention to cost of nutrition, which is super important. We need to try to do it as cost effectively as possible. We look at breed back rates, but we're missing a lot of pieces of the puzzle because it's essential to the immune system to function, and then much more. By skimping 1 year of nutrition, you're really losing production and immune system problems for multiple years. Next slide. So body condition score at calving. If you're going to start really delving into this and keeping records, that would be a really great place to start. That is really a great time because body condition score, if we're in adequate body condition score at calving, it sets us up for a really good next at least 3 years. Body condition score breeding is important. So if cows calve thin and then they've gained a little bit, it's kind of hard because they're lactating, but that really can't make up for poor body condition scores at calving. Those cows are just going to not cycle in an appropriate amount of time. So we really want to calve cows at a body condition score of 5 to 6 and heifers at a 6. And again, if we're not doing that, we're losing money over several years. Next slide. So under nutrition in the last trimester, we're going to get thin cows have prolonged labor, which leads to more stillbirths, more dummy calves, lower birth weights, and then poor calf, just vigor. And so FPT is failure of passive transfer. That's when calves don't get colostrum. And so if you have thin cows that are not getting enough protein and energy, those cows are not producing adequate quality colostrum. So even if the calf gets up and nurse, they're not going to get that colostrum that they are supposed to. Those calves are more likely to get cold stressed. They have lower disease resistance. And again, sometimes it takes good records to recognize this, but recording those body condition scores is going to be a big hint. We also don't want overnutrition. That can also lead to calving difficulties, especially overnutrition in our heifers, poor milk production. They can lay down some fat in their udder that can lead to decreased milk production. Next slide. So a study out of Oregon, and this is just one of many, an example. So just dropping from a body condition score from 6 to 4, 4 is not bad, but it shows you how much production we're losing. So those body condition score 6 cows had less calving difficulty despite higher birth weights. Those cows that are in good condition are just able to deliver those calves appropriately. Calves had heavier weaning weights. You had 11% more calves. Fall preg rate was much higher. And so obviously a higher net annual return despite higher feed costs. So again, you still have to look at your feed costs and keep those as low as possible, but we can't just not feed. Next slide. So fetal programming and epigenetics, this is a relatively recent field in livestock. It's been studied in the human side for a while, and so we've always kind of looked at that last trimester and making sure we need good nutrition in that last trimester because that calf is putting on pounds. But now we know that we really need nutrition throughout gestation, from the time that calf is a conceptus in a small fetus, because that's when our organ systems are forming. That's when the placenta is growing, which then allows the calf to continue to grow. And so malnourishment in any part of that pregnancy can really impact our calf health and production throughout the rest of its life. Most of the studies are done on nutrition, particularly protein, but any type of stress, heat stress, transportation stress could potentially have damaging effects. Next slide. So if we look at this diagram, over to the left there, we've got conception, and then all the way to the right at birth, and right there in the middle, you see where mid-gestation is. And so, you know, we're in the business of producing muscle with some fat interspersed, some marbling. And so if we have cows that are stressed or nutritionally deprived in the first half of gestation when primary myogenesis is going on, then we, you know, even if we have genetics for this calf to really grow, then if we have an insult during this time, that calf may not live up to its genetic potential. Same thing with fat tissue development. Those fat cells have to divide before then they can get bigger later in life. Next slide. So nutritional stress, again, mainly protein. If you have insults in the first and second trimesters, remember this coincides with high lactation demands, and so we want to make sure we keep up with those demands from a nutritional standpoint. And so again, that's when you have organ development and placental development. So if the lungs are insulted, for instance, when they're forming, cows don't have big lungs even when everything goes right. And so if we insult those lungs during their formation phase, then we will have more respiratory disease. Again, some of the other things that have been shown, calves will have decreased average daily gain, gain to feed ratio, tenderness, the number of oocytes available for the life of that female. And so by restricting dams 1 year, their female offspring can have decreased reproductive efficiency for the rest of their life. We don't know a lot about how this impacts testicular development, but hopefully one day we'll have those studies. Next slide. So second and third trimesters impact on birth weight is really variable depending on the study, but a lot of these studies show less pounds at weaning, decreased marbling, and then again impaired reproduction in those female offspring. Next slide. So to kind of sum up there, body condition score, which is a measure of how well we're doing nutritionally, is going to impact this year's calf crop. So if we have more calving difficulties, then we have fewer calves, we have poor calf health and vigor, we have pre and post weaning calf performance this year. Next year's calf crop, we may have fewer calves, we may have calves later, so we have less pounds per cow to sell. And then again, pre and post weaning calf performance that year. We've got some information on discussing calf health problems and some other talks and fact sheets, and then future calf crops. So again, that pregnancy or the reproductive efficiency of those female offspring, you can have, you know, impacts for years. Next slide. So what we really want to do is try to, if we look at a bell curve of our body condition scores, and if we have some thin cows, some cows that are adequate, and some cows that are maybe too conditioned, what we really want to do is try to tighten up and have most of our cows in that 5 to 6 body condition score and try to maintain them. And anything that doesn't fit, you know, if we're having to feed cattle extra or deworm them or look for a disease, but most of our cows are doing very well, let's just get rid of those cows that don't fit our system and our environment. Next slide. So biosecurity is also really important. Biosecurity is kind of keeping diseases out. Those are diseases that we already have in the US and foreign animal diseases. Biocontainment is keeping control of diseases we already have on the ranch that everybody has. So Sandhills calving system is a type of biocontainment by not letting those diseases build up in the environment that to a point where they cause disease. And we kind of lump those together because a lot of the things we do to prevent spread of or bring in diseases and prevent spread of diseases, there's a lot of overlap. we need to think about diseases in two big categories. So we have those short-lived diseases. So let's say you have, you take an animal to a show, it gets respiratory disease. For the most part, they're going to get over that. They're only contagious for a short period of time, relatively. So if we have a quarantine period, that allows those cows or heifers, whatever we're bringing in, bulls, to get over those diseases before we turn them in with our other cattle. There are other diseases that are they're carrier animals. So anaplasmosis, BVD, Johne's, trich, you have carrier animals that look perfectly healthy that are carriers for life. So we can quarantine them forever and they're still going to have that disease. And so the only way to prevent those from coming in is we have to test for those diseases. And, testing for anaplasmosis, you kind of need to know the status of your herd, whether or not it's even worth it or not. And again, your veterinarian is the best person to help with what diseases you should test for and when. And so what we're trying to do is based on, your level of risk, whether you have a relatively closed herd or you have, you're buying and selling a lot of cattle all the time and have a lot of risk. We have to find kind of what's necessary and practical for every day. And then we also have to be able to ramp things up and lock things down if we have a foreign animal disease outbreak. Next slide. So biosecurity protocols are really the cheapest and most effective means of disease control. It takes planning. And no disease prevention program is going to work without biosecurity. And we mentioned why it's so important for some of those diseases we talked about. Trichomoniasis, again, we've got to keep this disease out in the first place, because once we get it, it's difficult to get rid of it. We don't have a good way to test animals. It's basically just a time. It takes several years to get rid of it. And again, it also helps us protect against foreign animal diseases, and a documented biosecurity plan could be tied to a disease indemnity in the future. It could be tied to getting a movement permit if we have a stop movement in the case of one of these foreign animal diseases. And so there's a lot more information about ways you can protect your herd and your business, and anybody can contact me about that information. Next slide. And one of the ways to think about biosecurity is how diseases are spread. And so instead of looking at it again from a disease by disease standpoint, if we know that diseases are spread, whether that's animal to animal, animal to human, and back and forth, they breathe on each other, cough on each other, direct contact, fomites are things that we would use like a trailer or equipment. Cattle can, oral would be contaminated feed, vector-borne, hard to control vectors in our environment, but, and then zoonotic, people can bring in diseases. So if we think about how would we prevent the transmission? So a quarantine area is basically just an area fenced off where there's no nose-to-nose contact with other cattle. No direct contact with potentially trich-infected bulls or cows. So if we look at it from a transmission standpoint, it's a whole lot easier and simpler. Next slide. And again, there's a lot of resources out there. If you go to BQA.org, there is a daily biosecurity plan template that you can fill out, and then that goes a long way in getting you ready for a foreign animal disease outbreak, which would be where the secure beef supply plan is. And again, everybody has a different business model and different levels of risk, and so you have to fill these out, work with your veterinarian, so you're protected. Next slide. So we're not going to talk about vaccination programs because that's something that is very, very specific to your herd. It's not just about what vaccines, it's about when to give those vaccines based on what diseases we're dealing with, and what other, how we're going to work these into our management system. Next slide. Genetics. So really exciting times that we're living in right now. What would be ideal is if we could select animals that are just genetically more resistant to disease. And we know that that's possible, and we've got a lot of technology and a lot of studies being done on this. And so finding animals that are resistant to disease in general, and then maybe we will have some markers that say, well, these cattle are going to be more resistant to respiratory disease or Johne's or Anaplasmosis, things like that. So that's really, really exciting. Next slide. So genetic selection for disease resistance, how important is that? It's very important. One of the things that we have to think about is when we select for one thing, we might be selecting for or against something we want or don't want. And so some previous studies have shown that if you select for high immunity, you might be selecting against production. But if you look at how much disease costs us, if we can prevent that, then from an economic standpoint, it still makes a lot of sense. So we might be giving up a tiny bit in production, but we're losing a lot less. So if you look at some of the simulations that have been done, and if you look at comparing an EPD for health versus an EPD for other things, how would you weight those in some of our decisions? Health should be weighed 7 times more heavily than some of our really common things we select for, like weaning weight, post-weaning, average daily gain in feed intake, and 2 to 3 times more heavily than some of our carcass traits. Angus Association is working on foot scoring EPDs, which is also really exciting because we got to get rid of some of these genetic controlled foot problems. Next slide. So finally, a little bit about just decreasing stress. So stress, we know stress is not good for our immune system. Stress is not good for cattle immune system. It's not good for production, and it's also not good for product quality. Next slide. So there's a lot of stress in cattle's lives, and some of it we can control, some of it is more difficult to control. We can control nutrition, we can control parasites. We've talked a lot about today controlling disease. What are some of those other stressors? We have to wean calves, but how do we do that low stress? How do we, try to commingle as little as possible, deal in large groups? Transportation, heat stress. We're not going to get away from heat in Louisiana, but how do we manage that? Shade, clean water, things like that. Castration, dehorning, and then cattle handling. So we have to handle cattle, but we can do things to make it as low stress as possible. Next slide. So what we want to avoid is things that add up, and having these stressors happen at the same time, because that is going to decrease our immune system below that red line, which is a threshold, and then all of a sudden we get sick animals. Next slide. So low stress weaning, one of the things that I think a lot of people can work on that can make a huge difference. These cattle spend less time not eating, they spend more time eating, they spend less time balling, pacing. Balling, pacing, not eating is not good for calf growth. Again, it suppresses their immune system. It's really better if you low stress sort your cattle, low stress wean, preconditioning, all these things start to kind of add together in a positive way. 3 different ways to do this fence line weaning, and there's information on all of these techniques. If you want more, contact any of us in the Ag Center. Leaving these calves on grass if possible. You got to have a good fence here, but making sure you have good shade and water close. But fence line weaning can be a really, really good technique that, other than a really good fence in a good location, it doesn't take a lot of inputs. 2-stage nose flaps, if you don't have the fences to do fence line weaning, you can use these nose flaps. You have to sort the calves off, put these nose flaps in, and then put them back with the moms. And then in 5 to 7 days, you take those nose flaps out. So it does require working those cattle twice, but it is an option in some management systems. Temporary separation is not a lot of data on that, research data, but I know a lot of people who are doing it and think it makes a big difference if you can't do the former two. And what this is, for instance, if you are getting pairs up because you're going to synchronize in AI, when you sort those calves off to put seeders in, for instance, you can leave those calves pinned overnight, let the cows out across the fence, and then turn the calves back in the next day. And if you can do that twice, it's both pre-weaning, it's even better. And it does something to that calf's mindset that tells it, yes, I'm separated from mom, but it'll be okay. So that when you do wean them, they wean much quieter. They pace a lot less. Next slide. Preconditioning programs. The really magic part of that is hanging on to those calves for 45 days. That seems to be the critical time, so that once they move after that, they have a lot less problems. This is just really getting, again, these calves over the stress of weaning. And lots of different ways you can do this. It does need to be cost effective. You have to look at your cost of gain, your price differential from light and heavy calves, and work out the financials to see if it's financially viable. But it is really good to decrease the stress of these calves, and they do much better once they either go into a stocker operation or into the feedlot. Keeping these calves on grass is not only in some cases economical, but those calves stay healthier. They know how to eat. But there's a lot of different ways to do this. Next slide. And again, all of this stuff kind of rolls in together. So keeping these calves healthy in a preconditioning period, low stress weaning technique, low stress sorting, making sure these calves are eating and drinking, walking through them, making sure they have a good environment to rest. Some feedlots will actually have an exercise lot where they'll move calves. And when these calves kind of run into, we've all seen when you move calves to a new pasture and they run and buck and they cough, which makes them cough up dust and bugs that might cause pneumonia. And it also teaches them, when you're moving them back and forth, it also teaches them, how to be manageable and move and not be scared of people. It makes them calm down. And so once they do get to a feedlot, they perform much better. Next slide. And that brings us to low stress cattle handling. Besides, making sure we really pay attention to nutrition, good place to start with low stress techniques is a low stress weaning, and then working on our low stress cattle handling techniques. This takes willingness to learn. It takes some time to learn. It takes patience to, maybe retrain your cattle. It takes some patience to maybe work on your facility some, but it really, really, really pays off because, when we are really fighting cattle hard and fast, hot shots, yelling, cattle are jumping out, they've been run, over, a lot of distance, their immune system is just going to fall apart. And so, if you're getting cattle up and they're super stressed and you're going to put a vaccine in them, you're not going to get the benefits of those vaccine as well as if they were handled, much more quietly. It does prevent injury. This is a dangerous profession and job, and so it just makes things a lot safer. Lots of environmental benefits of being able to move cattle to different grazing areas, get better utilization of your grass without having to have fences and some more extensive grazing situations. Disaster prep, if cattle are stranded in floodwaters and you need to move them, if they're used to being handled quietly, just one less stress on them. We've all, been in situations where everybody's hollering at each other and cursing each other out and calling people stupid, and you never feel like you're in the right place. And that is, we joke about that, but it's really, why would our kids want to come back into that environment and stay on the farm or stay involved in this industry? And then at the end of the day, it just pays. So, you know, if you're not using low stress cattle handling while you're synchronizing cattle and artificially inseminating them, you're not going to get the reproductive benefits that you would like. Again, better health, less shrink when loading. When you can load cattle quietly, it's just gonna pay off. Next slide. So why not? Again, it takes time. It takes planning. You've got to learn. I went into this thinking, you know, I've worked a lot of cattle in a lot of situations. You know, what can I learn? And then you watch somebody who shows you a different way and shows you a better way. It takes time again to kind of, if we've been handling cattle a certain way for a long time, they're used to that. It takes time to reverse some of that. A really good place to start is with your heifers. It takes a culture change, but it's probably one of the most rewarding things you can do. It makes life a lot easier for you and the cattle, and has a major impact on animal health. Next slide. So a lot of information out there about a bud box. That is a really, really great way to handle cows. A lot of feedlots are getting rid of their big tub systems and solid sides, curved, and going more towards open sides and a bud box. And so I would encourage you to look at plans for bud boxes, how to they're actually a very economical way to put up a handling system. It needs to be done right. There's some rules there to follow. This was a bud box at a feedlot in the panhandle of Texas that I toured last summer. And one of the things that you have to think about with a bud box is to make it work the best is you have to be inside in the pen with the cattle, which is not always going to be appropriate depending on the cattle and the situation. And so this was a fence that was along one side of that bud box that had little man gates, so you had an area to get out of the way of cattle if there was a dangerous situation. So this system worked very, very well. Next slide. And then there's temperament and disposition. So about 80% of our attitude problems are directly related to us, how we handle cattle, but about 20% of them doesn't really matter what we do. There are cattle that just need to be culled on disposition. Those cattle are not going to have the reproductive performance, the growth, the carcass quality, all of these things that are goals of ours in the industry. And so we need to get rid of these animals. They genetically pass on this disposition. And so we need to try to slowly find those cattle that handle appropriately and get rid of the ones that don't. Next slide. So in summary, the most costly diseases of beef cattle are chronic, they're low grade, they impact production before health. So you need good records to pick them up. Prevention is really key. And there are a lot of factors in that. Everything we can do to decrease stress, increase biosecurity, feed these cattle is going to pay off. And in a lot of our low stress cattle handling, we're taking away that prey response. So when when cattle are scared of you and they are, we're not handling them low stress, they're going to hide diseases even more. So I thank everybody, and I'll take any questions.
Thank you, Dr. Navarre, and thank y'all all for being patient with us. If you'll give me just a second, I'm going to try to swap over to another slideshow. And as she said, please feel free to go ahead and get your questions into the Q&A box as we go through and I swap this over. So I hope y'all are able to see this slideshow currently. So we do ask that if you take, 3 minutes or so to go in and complete the survey for this webinar. You can do that a couple of ways. You can get your phone out and use the camera on your phone to view the QR code and click the notification banner straight to the survey. I'll also post a link to the survey in the recording of this video. So again, I think there's 3 to 5 questions on there. It doesn't take long, but we greatly appreciate your feedback on that. Also, too, there should be a place for comments on that particular survey. And so we have a couple of open months this year for Beef Brunch webinars, and so we are open to the topic suggestions. So any topic ideas or things that you want to hear, please let us know, and we will get those out for you during one of those open months. If you've not joined us before, you can go on to our website, lsuagcenter.com/beef brunch. You can find us on YouTube at LSU Ag Center-Livestock. I will get this recording cleaned up, and we'll get that to y'all sometime probably within the next week, and try to get out of this really quick. So I don't see any questions at this time, but again, if you have any, take just another minute or so.
Ashley, you've got one question. Can we get a copy of this presentation in the Q&A?
So that's up to Dr. Navarre in terms of the PowerPoint. I'll let her speak to that in just a second, but I will publish the recording of this within the next week or so. So again, that website there, lsuagcenter.com/beef brunch. I keep our most recent 3 webinars on that website. All of our webinars are found at LSU Ag Center-Livestock on YouTube. So if you just search LSU Ag Center-Livestock channel on YouTube, will pop up. We have a specific playlist just for Beef Brunch webinars. So Dr. Navarre, I'll let you comment on whether you want to share the PowerPoint or not.
Yeah, some of these photographs and diagrams are not mine to share, but I'm happy to share a PDF copy. And probably the best way is for people to email me, and I can email that back. It may be a little bit easier to share too, because it won't be such a big file.
And your email would be cnavarre@agcenter.lsu.edu, correct?
Yes, correct.
I just put it in the chat box, Ashley.
Great, thanks.
Thank you, Jason. Thank you for catching that too. So I think I'm looking at the correct slide now. I don't see any more questions. So again, thank you all for your patience today. Technology is great until it decides to not work so much for us. Dr. Navarre, again, thank you for your time, and we hope that you have a wonderful day.
Glad to do it. Have a great day, everybody.